All right, I'm just trying to make sure my mask is properly fit. I think it looks good. It's just right on my beard. That's exactly how it should be. Looks fine. So, okay, now that my mask is appropriately done, I want to ask you this trillion-dollar question. What is identical, and that's for you also, Bikram, what is identical between Abhishek Bachchan's film career and India's COVID-19 lockdown? The whole career and India's COVID-19 lockdown. Wait for it. They are both spectacular flops. That's the similarity. All right, now that somebody told me that I'm doing podcast, so I don't have to wear my mask anymore, so I'm just removing my mask from my beard, which was the appropriate way of wearing it. That is another probably may be a problem because of the flop situation. Now, the fundamental purpose of a lockdown, for any reason, for any nation, was that nationwide lockdown, that's a virus which is named after this delicious beer from Mexico. That doesn't spread across the country. So that was the fundamental purpose of it. Just the same way Abhishek Bachchan's fundamental purpose of it, doesn't matter how bad the movie is, it just needs to make money. So same way, if everything went right, as long as the virus did not spread, that would have been fine. So as they say, plumbers and numbers don't lie. Plumbers are not available right now, but I have numbers, courtesy Worldometer, because there are a lot of people who are making numbers. I'm not going to really go for Aaj Tak and all. So Worldometer says the infections in India are almost 10 million, which is in Indian speak 1 crore. A lot, looking good. We are world number 2 in that. I'm really blaming that on Donald Trump because, if it weren't for Donald Trump, India should have been a number 1 in this thing. Now we're number 3 in deaths, which is somehow, like in the last month or so, Brazil has been like just zooming in, and Brazil is number 2, US obviously is number 1. We are at 136 according to Worldometer, 36,000. Now that means, just like Abhishek Bachchan's films, I'm not going to say his name anymore after this. This thing has also been a failure because obviously you can't be number 2 and you lock down everything. You shut down the entire economy. You just screw up everybody's life, and then you don't even. Still, the virus spreads. And I'm not blaming the government. I'm just saying the lockdown was a failure. At certain time, people could not have known, and fuck ups happened. This is something which was unprecedented. The pandemic is not unprecedented. The COVID-19 is unprecedented. Let's be very clear on that. I'll give you an example on that. Now, because Spanish flu, because if you think about larger scheme of things, then Spanish flu, which was only 100 years ago, which was COVID-18, or sorry, Spanish 18 if you want to say 1918, which killed approximately 50 million people. Now, COVID-19 as entire world has killed 1.45 million people at this stage. So we're looking at, this is like a very minuscule number from a pandemic comparison to another big pandemic. This is very less. And that was massive. And when Spanish flu happened, it engulfed at least 1/3 of the population, like the entire world's population, or 1/4 of that. It was just crazy because around 500 million odd people were infected because of that, and which was around 1/3 or 1/4 population of the world at that stage. Now, here's my view. This is my personal view that India should never have gone for lockdown. None whatsoever. Forget about anything. Zero. Absolutely zero. Now, I'll start with a general example just to explain to you, because when you're comparing 136,000, I want to really compare with real numbers, which people do not understand and people just forget because these things happen all the time. I say like, this is what is happening. It's not completely unprecedented because people feel, oh, a lot of people are dying. But I keep saying people die all the time. And people are like, that's cruel way of saying because you don't care. No, I don't care. It doesn't matter whether I care or not. People die all the time anyway. It has nothing to do with Gaurav Best. Gaurav Best does not do anything. I don't even run my own house. Now, hundreds of websites, if I give you an example, if hundreds of websites did the same thing for that example, for those deaths, you will be like crying even louder, and not just for like few months, every single year for the rest of your life, for the eternity. Now I'm talking about road accidents. Now, if hundreds of websites and hundreds of news channels gave hourly and daily death updates, that will be 17 deaths, 17 people just died this hour. Oh my God, 18.2 people died this hour. 414 people died today, and they will die again tomorrow, and they'll keep dying. 151,000 people die every single year of road accident, which is, by the way, we are number 1, just to be proud of that, because we are number 2 in the COVID deaths, but this time we are number 1 by far. China is number 2 by 63,000. Not even, there's no chance. It's literally the same way India is getting battered in the one day international. It's the same situation right now. So 151,000 people die every single year, which is higher than COVID, and every single year they've been dying, and this number will only keep going up. But nobody even cares. Nobody even bats an eyelid. We're like, oh, people dying, who cares? Doesn't matter. My father did not die. It's fine. So my point is that all these numbers, if we keep comparing directly to number than corona, these numbers are higher than corona, and this happens every single day. I'm just talking about one single disease, because cardiovascular diseases kill approximately 20 million people every year worldwide, over and over again. Now, some people will complain that this is not direct comparison, it's not best, we can't control it. But yes, we can control it. My point is, if people die on the roads, do we shut down the roads, or we make sure the cars are safer, we have better light system, we have people follow the rules better? Would that not be a better idea instead of shutting down the roads? Or because people are going to go out, they're going to die, because people are going to die all the time the moment they step out of the house, or they do not step out of the house, because they will just atrophy and die because of that. Now, I will give those links also, the website. People are like, oh, is he making up this stuff? I have never heard of anybody dying of road accident in India, which can happen because you've never actually spoken to anybody except watching Netflix for the last 16 years of your life. Now, the most important rule for me is that cure cannot be worse than the disease. I think I'll give a few examples, but I don't want to go on this. I'll just say something and I'll let Vikram, you come in. My point is that lockdown itself is not intrinsically flawed, just the way socialism is not intrinsically flawed, just the way certain things in the world, like quota system, is not intrinsically flawed. There's no problem in that. Just the way feminism, just the way liberalism is not intrinsically flawed, same way lockdown is not intrinsically flawed. The idea was correct because you're trying to save lives, which is the most important thing. When you say about lives, it's all about human beings, particularly richer ones. Now, lockdown will work perfectly. That's why I didn't send you the notes, because I just wanted to, also you should have some novelty factor. I put in 3 points. Any highly advanced country where it will work, and highly advanced country, highly advanced, I'm talking about technology and other things, and high income, which sort of goes hand in hand, but doesn't always have to be that way. Now, highly, because generally speaking, Israel is very highly advanced, but not particularly high income. Like they're rich reasonably, but not high, like they're not super rich. So they're highly advanced, high income, and major rule is highly rule following country. And so in general, particularly also a low population country. So I think actually there's 5 things. So I think probably advanced and probably similar, 4 things, sorry. And then an underdeveloped country, an overpopulated country, and rule breaker country, which is not very advanced, it will fail. And we fall into all those 4 categories: underdeveloped, overpopulated, rule breakers, we love it, and obviously we're not highly advanced because even our taps don't work properly. Now, we fall in that country, and that's why it was going to fail. And this is not rocket science. This has nothing to do with COVID-19. This is prior knowledge, and you can compare it to any other country where it worked, the lockdown, where the lockdown did not work. Because you can talk about Pakistan, any poor country, lockdown will not work, simple as that. Pakistan, in fact, said we're not going to lockdown because we're too poor for lockdown. In fact, one of the most smartest thing that they said was this, because yes, you are too poor to have a lockdown because people are going to die all the time. I'm going to come back to statistics of that, what major side effects happened because of lockdown, and also the fact that not only did not stop the virus from going through, the side effect was so bad. It's like you take a vaccine, you also die of the disease, and then also in case you don't die of that disease, it gives you so many other diseases that you end up dying anyway. So that's exactly what happened because of the lockdown. So I want to give the ball over to you, and then I'll come back and elaborate more on that. Otherwise, I'm just going to go on and on and on and on. They'll be like, okay, one-sided. Yeah. So that was my thing. If you have something else to say on that, you can please say. If you dispute some numbers, yeah.
No, I'm not going to dispute any numbers, but I maintain, as you said, that you felt that lockdown was not something we should have. And you have been saying this from day. It's not something, I just want to inform everyone that this is what Gaurav has been saying all along. When the first lockdown happened, that time also, it's not something which he started believing now when we see that the lockdown didn't help so much. But that time also, I believe that lockdown was necessary. There are things which you already touched upon. I'll also touch upon that. That which should have happened along with the lockdown, because when the first lockdown happened, there were not many cases in India. The cases were growing, but we were still not at a level where it was threatening compared to where we are now. Right now, 40,000, 50,000 cases have become the normal day, as we call business as usual. So if it goes above 50 to 50, 60, then people think, oh, it's growing now. So I mean, lockdown, I felt, was necessary. And also you have to consider, now we have lot of more information about COVID. That time even WHO was not completely sure that how this is working, right? Sometimes they were saying this is spreading in the air. Sometimes they were saying it is not spreading in the air. So there was a lot of misinformation, miscommunication, whatever. But the major issue with the lockdown was that when the lockdown was announced, it was done very, very haphazardly. There was no plan, and when Prime Minister came on the television at 8 p.m., he announced the lockdown. He said that why the lockdown is necessary. He said everything. He tried to convince everyone that lockdown is something which is the need of the hour. All that was fine. I was fine with that. But there was no plan to back it up. Even the states, the police, the bureaucracy, everything, all the system which support the government, they were not ready. They didn't have any clue. If you remember, when the lockdown started, police was beating those delivery people. Then it came out that delivery people are fine. They come in under essential services. So before going to lockdown, these things should have been finalized. These should have been sent to the people who will be administrating all these the state government, the police, and everyone. So that time we still had few days to properly plan the lockdown. That was the problem, because you don't need to be a very don't need data. You don't need data analytics to understand that what is going to happen if you shut down the country for 21 days. So there should have been better planning. There should have been contingencies, everything. The migrant, whatever happened with the laborers, the migrant laborers, that should have been anticipated. So when Prime Minister Modi came on television and announced the lockdown, he should have also given details that how they are going to support the people for 21 days, because from tomorrow everything will be closed. There are people who don't have milk at home. There are people who don't have food at home, who have no money at home. How are they going to survive? So that was the biggest problem with the lockdown. I still believe that lockdown was necessary because mainly because our health infrastructure was not ready. So it gave some time to our health infrastructure. I know that was not the point of the lockdown, the first lockdown, because that time it was widely believed that if everyone stays home for 14 days, then the virus will get killed. And that was the logic behind the lockdown. So that's why they did it for 21 days. And then it went on and on for a few more months. So my point was that lockdown, I felt, was necessary, but it was done in a very haphazard way, in unplanned way. There should have been some kind of planning. There should have been some kind of thinking behind it, that how we are going to mitigate all the side effects of those 21 days. So yeah, that's my thought.
All right. So see, which is fair enough. Only thing I will say is that it's not that. Yeah, I agree completely that time there was definitely a lot of doubt. But by that time, China had already, because in China, they already had the lockdown on January 24th. If people do not know, they had a countrywide lockdown. 26 million people, which is almost a billion people, were already in lockdown. And the rest of the people who I'm talking about, which is in China, they were like in those provinces where like nobody ever goes. So there was no point of locking those people down. So primarily all the big cities and all, they were like completely locked down. People are not allowed to move around. And they had the plan in place. Now, that's another podcast altogether. My point is that I'm going to give an analogy here. Now, why I feel people are like, okay, you don't want lockdown. What the hell do you want? I want something exactly what happened in South Korea. I want exactly what happened in a lot of Asian countries, Hong Kong, Singapore, and all those countries. Now, which is called aggressive testing. But just for people to understand and make it more interesting, I have prepared an analogy. Now, think about this match, and also India and Australia are playing cricket right now. So that's a easier one to digest. Think about there's a test match, and it's in Sydney because right now they're playing in Sydney. And if people know something about cricket, then they know Sydney pitch spins a lot, particularly and if it's a fifth day spinning. So now we have 23 runs India need to win. It's a Sydney test match, fifth day wicket, and we have 1 wicket in hand. Two great batsmen are on strike. We need 23 runs. Two great batsmen on the strike. One is Jasprit Bumrah. Other is Ishant Sharma. Now, these two great batsmen are there, and there is a very, very ordinary spinner is bowling, whose name you may or may not remember or have ever heard of. It's called Shane Warne. Guy has taken about 800 wickets, something like that, into international cricket. Now, Lockdown strategy was similar to asking Jasprit Bumrah and Ishant Sharma to defend on a fifth-day Sydney cricket ground pitch where Shane Warne is bowling and the ball is spinning more than your head would be spinning after 10 shots of tequila. I'm talking about real fucking tequila. And now asking them to say, okay, don't worry about it, take your time, wait for Warney's bad balls, you hit those bad balls for boundaries and we'll win the match. No, it's not going to work. The better approach would have been to go for broke, throw their bat at fucking everything. These people, they are fast bowlers, okay? They don't know how to bat. If they throw their bat, ball can actually disappear. And particularly it's a spinner. You can hit him, whack him everywhere. So have some lust couple and hope for the best. Shut your eyes, hope for some lusty sixes which have happened. Now, if you're going to wait for the right delivery, it's just not going to happen because you just don't have the technique for it. And that was my point earlier. We do not have the equipment to make sure the lockdown will work. Although, as I said, it's not fundamentally bad because if it's Sachin Tendulkar playing on spinner, he said, okay, you can hit the right leg. And if it's Rahul Dravid, definitely go for it. But it's these people. So in my word, aggressive testing in March would have been, instead of lockdown, would have say more gazillion times more effective in approach than lockdown. That was doomed from the very beginning, just like Vinod Kambli's career. Right. So Vinod Kambli, I'm sorry about that, but it was doomed from the beginning. Now that was my idea. Now if you want to pitch in, or I'll continue from there.
You can continue.
Okay.
Yeah.
Then I'll continue. I want to talk about the lockdown side effects now. I only have listed few. There could be gazillion, but I just want to talk about few of them. One is, and I'm not going to dwell too much into it. One is domestic violence, massive problem. Depression, okay, huge problem. Depression. If yesterday I lost a job, and if I didn't have enough money to put on the table, and I don't even have any responsibilities, I don't have to pay for my parents, I don't have wives, kids, or anything that I have to pay for. Unhealthy habits that have developed over the lockdown, and people have now something to blame on. We've all seen tons of people carrying that, which I'm calling CoronaWeight, around their waists, and they're saying, it's a lockdown situation, so I just. Then to more serious, like depression is already serious, but right now I'm going to say suicide rates have just completely gone through the roof. Now that's like saying it's just not saving somebody, just alternate way of dying. It's like saying you survive a fucking plane crash and then get killed by a fucking hungry bear, because where they put you now is exactly where Leonardo DiCaprio's Oscar-winning movie The Revenant was shot, and they were like fucking all these hungry bears, so they just eat you up. That is another problem. Now I'll give you a few statistics, and these are again I will punch in the websites as well. All legit. It's pretty straightforward. I mean, you can see what's happening. It's not even like people can't even make this up. This is prima facie evidence. Job losses. The number says in 2019 in India, out of the 520 million people who are employable officially, 404 million people were employed. So 40.4 crore were employed. In March, the numbers had gone down to 396, because that's just the beginning of it. So because slight slowdown, so that's looking at 8 million had gone down over a year or something. For whatever reason, I'm not even blaming directly on coronavirus, because that time we still did not know much. But in April, statistics say that the number is now to 282, and that is 122 million people have lost their job within a month. And people are like, how can that happen? But that can happen if you suddenly say out of the blue that it's gone, just the way demonetization happened. So people are like, how can these notes like completely go out of circulation? Because just the way you just said, you can't use them. Same way, if you just can't go to jobs, and then if you're a construction worker, all these low-level jobs, you can't go to people's houses to clean toilets or do whatever the shit you're doing, then your jobs are gone, and there's no fallback on that, right? So these jobs are gone. Can you actually imagine 122 million losing their job? Like, it's crazy. Right. And compare that to the impact that COVID-19 had that in a month. It's just chalk and cheese, right? The amount of people who are dying directly or getting infected, and compare that to 122 million. Like right now, 136,000 people have died after all this time. Within a month, 120. Do you understand what would have happened to these people? These people this is where I'm talking long-term problems. Now, and another survey, before the long-term problem, I'll talk about another survey that showed that says around 40%. These numbers are, again, when I'm saying these numbers are very lower, what I'm saying, the numbers are even higher. The numbers showing around 200 million people are underemployed, because what has happened is now they have no real work. Either they've gone to villages, or people are just like, fleecing them. Like now they will take whatever the money can be given to these people. So they're earning, numbers say they're earning at least around 50% or less than 50% of their former salaries in urban centers. Because now you don't have a job, we don't care, we'll pay you this thing, will you work? You have to put food in your family's mouth, you will work. So that's a problem. 200 million people. It's ridiculous. Most of these jobs lost were borne by poor people who live, as we say in India, hand to mouth situation.
Yeah.
In simple terms, if these fuckers are unemployed for 1 week to 4 weeks maximum, they move to the red zone. This is not a statistic. This is my way of speaking, and I'm calling them red zone being starvation, which can go as high as death. That was my concern of this situation, that it is whatever happened during lockdown. As I said, fundamentally, I don't disagree. If somebody said you want a lockdown, my problem is how the lockdown was handled and how it was taken care of, as something you already talked about earlier.
Yeah.
And it is very evident for me that lockdown is only saving rich people, because if you're saying, it's a practical joke for me to people, like it's saying, like telling you that hundreds of millions of people to go back home and stay home, stay safe. Now, I don't have a fucking home. So where the fuck am I going to go and stay safe? Second is, if I'm on rent, which is hundreds of millions of people on rent, now I cannot pay that rent and I'm going to get kicked out because my job is gone because you asked me to go home and not work. Now, this is just a very, very cruel joke, because people have lost their lives. And other problem, I feel like now the people who are depressed, who are in debt right now, and this debt will not be gotten rid of for not just years, for decades, or probably for the rest of their lives, because anybody who goes through something so traumatic, something like this, it does not come back, because now they're getting jobs, either they're getting jobs or not getting jobs, but they're getting paid much less. They've already incurred debts and losses, and in their mind, because we are a very conservative society, we get negative very quickly. Any person, Bikram, that you meet, I'm just asking your opinion. In case you have a different opinion than me, please go ahead and say it. But every person I meet has become even more conservative, and they tell me, because you know that I always constantly try to say I want to quit this job. Every person I tell this, why are you quitting the job? It's very difficult to get another job. Why are you doing this thing? And that's a natural thing. It's not even a bad thing to say, but it's like whenever they hear me say I'm going to leave my job or something, and people are like, why are you doing that? This is not the right time. Why don't you just wait for a little bit, another year, 2 years? I mean, depend people. Some people say 10 years also. I'm like, okay, dude, just back off. I just said I want to quit my job. You want me to wait 10 years? I'm going to be 50 years old or something. I don't know. I'm already in pension bracket. Though the problems with which happened in our country are massive, and we cannot just overlook those situations, because if PM Modi, I don't have to disrespect, I'm not saying this to disrespect Mr. Modi, the government or everything, but I'm saying there's a lesson to be learned, because we'll be doing another podcast, because we are supposed to shoot that today, but I think it's just much more serious, which was about what we should do the next pandemic, because I feel pandemic right now, this SARS-CoV, which is the official name, SARS-CoV-1, and this is SARS-CoV-2, and SARS-CoV-3 will also happen 15 years later, which is almost following the same trend as James Cameron's movies, which happen every 12-15 years. It's like he makes Titanic in 97, then he makes it in 2009, then the next movie is going to come out. Apparently it was supposed to come out this year, but it got pushed because of this pandemic. They're like, okay, we can't have two pandemics at the same time, because he has Pandora, so that's Pandora, not pandemic. So Pandoramic. So that will happen, because I was just in my mind, it felt that way. But I just feel we are very lucky, you and I, and a lot of people who are listening to this podcast. We can't understand what is going through people, because we walk outside our house and we call a fucking cab, and the cab does not show up for 5 minutes. We're like, bhaiya gum gaye kya? Ye samajh nahi aa raha rasta. And people are carrying their kids for 400 kilometers, and then they reach a place finally. They don't know if they're going to get food there. People are getting beaten up on the road. We are a country so haphazard. Forget about, you're saying we should have a plan in place. They're beating up delivery workers to start with. How stupid can you be, man? How stupid can you? It's not even you not seeing that delivery worker. They have jerseys and all. And you're beating them. They're getting you food. And the same people who probably got you food half an hour ago. You're so fucking stupid that you're beating that person. And if you and I never gotten beaten by the police, right? But if we get a hit by the police, that fucks up your psyche. And I'm just saying very small thing. People, I mean, I can't even understand this thing. And this is not to blame anybody, but I'm just saying something which happened did not work, and it continues to not work. We cannot take away people's livelihood in fear of something that is probably never ever going to be that problematic anyway. But you cannot say go home and stay safe when you have nothing to eat. And another long conversation, but it just right now I feel it just completely failed, and it was always doomed from the start, because there was no way, because we did exactly the same thing. And I'll not go on with this, I'm done with this. We did the same thing we did with demonetization, and then we did the same thing with GST. We just winged it, just the way Donald Trump. But with demonetization, what the problem happens that people complain. As I said, liberals being bitches about that, and some people had to get in a fucking queue. We are Indians, we are always in a fucking queue. So fucking get on with it. So not a big problem. GST, a lot of, I don't know how to fucking use the computer, it's like too much problem, it's the forms are difficult, 18%. Yeah, they're trying to fix that. So it is an irritant. It's a problem. People have stand in this like November sun, which is not that hard. But this lockdown, this is real. People, I'd rather die than actually live in depression and debt, because that's something.
Yeah,
Because Vikram,
true.
I can't even imagine living in depression and debt. And then every time somebody knocks your door, every time your phone rings, it gives you a fucking chill, man. It gives you a chill. Because I remember there was a time I had some minor credit card debt, and the phone used to ring. I would not even pick up. It would scare the fuck out of me. It was it's not good. It's not good. And there's this people, and unlike us, the poor people are like, they fuck themselves obviously by having 3, 4, 6 kids or something. It doesn't help the cause, but what are you going to do? And now the least you can do is like not fuck them over anymore. And I every day go to the slums, not every day, sorry, every week I go to, I just came from the slums. I was playing cricket with these people, and they're still lucky, the slums I'm going to, but there are a lot of slums which are just really, really difficult, but you can feel it, you can sense it. Another podcast altogether, but that was all I wanted to say about this.
Yeah, I think I agree with you completely, and it's difficult to make people do the same thing, right? We are all different people, and to expect that all the people will follow the same thing or will do the same thing or will behave similarly, it's just stupidity. And that's what happened. I mean, I think I can still understand first lockdown, it was done haphazardly, as I said, and there was no planning and anything. But after that, it should have been clear that this is not going to work out. This is not something that people can take. And it's not just about poor people. There are a lot of things, people who are not getting treated, right? There still, even now, a lot of hospitals, they don't take normal, they don't take patients for certain diseases. They say that there is you have to do a COVID test, and if you get positive, and if it's something which you need to like, just say that there is a surgery which needs to happen, but if you get detected positive, the bill just shoots up. It is happening. I have seen this. A lot of people have got delivered. A lot of babies got delivered recently, and they all said that they knew people who paid double of what they were paying for their normal deliveries because the mother was COVID positive. And it's not just, and it is obviously poor people, they can't even afford to go to hospital, right? They have to fight this disease if it happens to them, and they are the most susceptible, right? Rich people can still, or even middle class people can still stay at home. We are staying at home doing our work. All the companies are given work from home, but these poor people cannot do that, and these are the more susceptible ones. So these people, it just feels that nobody thinks about them, right? I was actually watching a small documentary on YouTube about people who in Mumbai, people who go to these nalas and clean it, because apparently it is illegal, or it has been outlawed that anyone should go into those nalas, those drains, open drains, and clean it. That should be done by machines. That should not be done by humans. But it's still going on. And scavenging. Yeah, it's not even scavenging. It's like you have been to Mumbai, right? There are a lot of open drains, and all the human waste flows into them. And then it's scavenging only.
So it's a human scavenging. It only happens in like very few places, and one of them is India, unfortunately.
Yeah. So it's actually outlawed by the courts, but it's still going on, and there are people who do that, and it's actually such a depressing work. They were showing it, that those people who do it, they hardly live to 40 to 45 because they get so depressed with that work, the mental state, that they go out and drink every night, and then they beat their children, and their children also don't get much education because of all this. So it just feels that whatever decisions the government or the administration, whatever decision they take, it's only for the middle class and the rich people. No one thinks about what is going to happen to the poor people. No one thinks about that, how they are going to survive. The government actually did a lot of good things about them. They gave before the COVID, I'm just saying that they opened the bank account so that the whatever benefits can be given directly to them. So all that was already there in place, and I think something should have been done. Something should have been done better by the government, especially that time when there were not many cases, because now it's very difficult to do anything, right? Now there's no lockdown as well, and in fact there was a joke, right, that when we had 500 cases everyone was inside, and when we have 1 crore cases everyone is outside. So therein lies the problem, that it was done too early. And obviously it's all about hindsight right now, that we know that that didn't work, so that's why we are speaking. But these are the basic things which could have been done properly. There should have been some planning, some there could have been partial lockdown. There could have been many things which could have been done, which we are doing right now, right? We are still open. People are doing their work. They are maintaining, I mean, whoever is maintaining social distancing, but there is some kind of fear, at least in big cities, because I've been to my friend went to smaller cities. He said no one is wearing mask also there, and I think I agree with you. I don't agree that there shouldn't have been a lockdown, but yeah, it should have been handled differently. And you also said that you are not against the lockdown, but it's just the way it was done. And there should have been more intelligent way of doing it.
I'm not against it. It's just same way I'm not against socialism. Is that right now the socialist wave everywhere, and they say that socialism is already been done 47 times earlier, and now it's failed 47 times continuously. And now people are like, why are you still trying it? Because now people think that liberals, that really, really, really extreme left liberals think it has not been done right. That's why it's failed. So we want to try it again. Well, it's just the same thing people said over and over again for the last 47 times, including Che Guevara, somebody I really, really admire. But some things don't work, and you need to realize it. Just the way quota system right now don't work, and I mean.
I think we talked about it about socialism in the some of the other podcasts, that the socialism is very idealistic way of looking at things, and it will only work when all the people are really honest, because that's what it's right. Everything has to be divided equally, but we have seen it. Why it fails? It's because of the people, right? People always get corrupted. People always make rash decisions. People always think selfishly. It's the same thing with Corona, right? I was wearing this mask at the beginning, and you were also wearing this mask in the beginning. People don't wear masks. People are only wearing mask, or even trying to wear a mask, because they think they will get infected. But actually, this mask is not only for them. It's for other people, that you don't spread it to them.
Yeah, primarily for other people, right? Eventually from other people, it's whosoever you're wearing, it actually helps you. It's the other people helping other people. And right now in Delhi, everybody's wearing. I was not wearing mask all the time, because sometimes I feel if I'm doing certain things alone, I don't want to wear mask. But right now, I'm also consciously wearing all the time. Before I was wearing when I were in public space with people, but I'm now wearing all the time, because now they're trying to fine people and shit, like a couple of $1,000 or something. I don't want to get fined for stupid reasons. So that stuff, and everybody's wearing masks. When I came to Delhi, nobody was wearing masks, and now everybody's wearing. From that day, Kejriwal announced, not many, 500, no more, 2,000 everybody. So they were like, oh, I don't want to get.
That's one way to fund his all free stuff.
Exactly. But I just go to slums also, right? Really poor people are not wearing it. They're like, we're not going to pay the money anyway. We're not going to pay the money anyway. So like, fuck you. And it's like, we don't have that kind of money. So you can't actually ask a poor person like 2,000. Like, मेरे पास है ही नहीं, क्या करेगा भाई? कर लो तो करना है. Jail में डालोगे. You can't even put people in jail right now because like, no, you can't put you in jail. Like, it's just like, screw that shit. But yeah, they would hit the poor people. I heard that some poor people were wearing it. They're like, they would actually whack us if they see us.
Yeah.
They slap us.
So what
also.
people do is, they wear it on the beard. I mean, I can't see you can't see me, but I believe you were wearing it like this.
Yeah, I was wearing it.
And then whenever they're entering some place where it is written that you have to wear a mask, they will just do it like this, not even cover their nose for whatever reason. And then when they sneeze, they'll remove it and then sneeze.
Yeah, it's like going to play cricket and wearing your pads backward, and they're like, okay, it's fine. No, you're gonna fucking break your knees with the ball and facing Brett Lee and fucking Jasprit Bumrah. So it's not gonna be a very good idea, obviously. So I think on that note, we can just call it in, and we'll continue doing podcast, and I think we'll be releasing a couple of them soon. And I have a very little one on Marathon as well, which should be supposed to be out today, but I think it's gonna be out. It's out. Okay, it's already out. It's a little tribute, a couple of words to Maradona, who recently passed away. Respect on that. So let's hope no more lockdowns, and jobs are coming back, so data looks good. Apart from China, which is all positive, everybody's in negative, but they're less negative.
In fact, new news is that China is now blaming India for COVID. They said it originated from India.
Conspiracy theory. I wouldn't blame them. Eventually, India will blame somebody else. No, they will blame US also. They have
blamed everyone. Right? Italy, they have blamed US. So now it's India's turn.
Fair enough, but they're smiling. All right. If we can't do TikTok, we can do something else, I guess. All right. Take care. Have a good weekend, and like and subscribe if you want to, and keep smiling, I guess. Take care.
Bye-bye.
Bye-bye.